In this video, we will be going over the diagnosis, prevention, and management of COVID-19. The gold standard to diagnose COVID-19 is through a nasopharyngeal swab. A nasopharyngeal swab is a technique used to collect saliva samples from the back of your nose and throat. The swab is made of an adsorbing material like cotton and is inserted in the nostril. The swab is then moved towards the back of your throat and rotated to collect some samples. The sample from the swab will then be sent off to a COVID testing lab to look for the virus strain. Other tools such as blood tests, x-rays, and CT scans may be indicated depending on how you present with the symptoms. The CDC and World Health Organization recommend that the best way to prevent becoming infected is by staying home and following social distancing guidelines if you need to be in public for essential reasons. This means staying 6 feet apart at all times. It is also recommended that good hand hygiene, good respiratory hygiene, and wearing face masks in public. Furthermore, it is advised that you disinfect frequently touched surfaces with solutions that are at least 60% alcohol. But what happens if you suspect that you have been infected with the virus? The CDC recommends that if you or a loved one are exhibiting mild symptoms, isolate yourself from the household and recover from home. While there are many guidelines to manage infected patients depending on severity, the main focus for treatment is to minimize the effects of symptoms. In extreme cases, where breathing function may have been compromised, patients will be placed on a mechanical ventilation to help the lungs with breathing.